Hi everybody, it's Jen. Just wanted to update you all on my DNC and hysteroscopy and also a polypectomy. They're all big words, but I got them. I think I pronounced them all right. But yeah, so I had it yesterday, and I am definitely relieved. I know that my last video I was saying I was nervous and scared, which I definitely was, but I feel a lot better now that it's over. Let's see, I went in at 6 a.m. yesterday. My surgery was scheduled for 8:30, so I had to go in about 2.5 hours early, which I thought was absolutely crazy, but I can definitely see why they make you do it. I was not sitting around going, where the heck is anybody? I was being processed for 2.5 hours. So basically what they did is ask me, of course, history questions about my family history and everything. Also got me set up with an IV. I got to meet a couple of my nurses. I got to what else? Oh, they took my blood because they wanted to take a blood, like the CBC, I think it's called, panel test before the surgery. So they did that. What else did they do? Just asked me a lot of questions. They already got my discharge papers together before my surgery, which was awesome because I didn't have to wait around for that. And I got to meet it's a teaching hospital, so the doctor had an assistant, which I met with her before, which was really neat to talk with, somebody that's learning and everything. And then I was taken to pre-op an hour before my surgery, and there I was separated from my family, which it was my husband and my mother who went with me. And honestly, that bummed me out because, I had this whole hour to sit there by myself and think about things and get anxiety and all that crazy stuff. So, that kind of sucked because in my past surgeries, I've been able to have my husband or my family with me before the surgery, and they basically said goodbye to me as I'm being wheeled into surgery. So this was a little different, but not that big of a deal. Once I got into pre-op, they got me going on some antibiotics, and 2 different kinds of antibiotics. And then then the doctor came to see me, asked me if I'm ready to go, do I have any questions for him. I told him, nope, I'm ready. It was so weird. I had like this calm over me, like right when I got into pre-op, like I was calm, and I don't know where it came from. I couldn't see because I couldn't wear glasses. I couldn't wear contacts, so like I couldn't see the other people that were having surgeries next to me. They could obviously see me. Maybe they couldn't. I don't know. But anyways, I don't know. I felt really calm and okay. So that was pretty cool. And then, sorry, I'm still shaking a little bit. I don't know why. But so then I met with the anesthesiologist, and I told him again that I was allergic, or not allergic, but I couldn't have that one medicine, which is called succoline, something like that. Well, it ends up it's a muscle relaxer, and they give you it. Actually, they gave it to me from what I was told because I was nauseated and they needed a muscle relaxer. But it is a muscle relaxer, and they gave it to me because they had to put the pipe down my throat. So he said that, or the tube. I always say a pipe, but you know what I mean, a tube. But this time, I guess they weren't doing that because it was going to be such a quick surgery. They were just basically putting a mask on me. So he said there was no reason to even be concerned about that because it wasn't going to be used and they didn't need it. So that helped me feel better. But like I said, it was so weird. I can't even describe it. I was just calm and I really expected to be anxious and panicky, and I wasn't. Although I don't know if I mentioned this in my previous videos, but I do have panic disorder, so I guess that adds to the anxiety that I had. And I was told that I could take a Xanax, which is the medication that I've used in the past. I haven't used a Xanax in over 2 years, but they told me that it would have been fine. They also told me that it is a Category C drug, so as far as getting pregnant or anything, I probably wouldn't want to use it, and that's why I went off of them. But I was also told yesterday that if I needed it, to just, even if it's here or there, that it would be perfectly fine to do that. They think that the benefits of that. Oh, there's my puppy. That's Sage. She's a black lab. But yeah, so the benefits outweigh the risk, and they were saying that if I felt that I did need it, that I should have took it. So I don't know. I kind of have mixed feelings on that, just because, like I said, I haven't taken it, and I didn't take it. So I mean, I guess whatever. It is what it is. But anyways, so they gave me the relaxation medicine, or so they called it. So I don't know if that was just like a sedative or something to relax me before they did the actual surgery, but they gave me that, and I was kind of out of it. I mean, I was out of it, but I was kind of in and out. And I remember them wheeling me in to the surgery, and I remember them telling me to scoot down into this little, it was like a little hole in the bed, kind of just to fit your bottom in. And so I remember scooting down, and they said, oh, scoot down a little bit more, and I remember scooting down a little bit more, and that's the last thing I remember. And I woke up. I woke up right away as they were wheeling me into the recovery. So that made me feel super good, because, I was so afraid of waking up, and sorry. So that worked out really well. And my bra strap keeps showing. So, yeah, so the results from what my husband and my mom had told me were they found 3 large polyps and a few small polyps in my uterus. One of the largest polyp, I guess, was blocking the bottom of my fallopian tube. So this could be explaining, sorry, I gotta switch hands here. This could be explaining why I haven't gotten pregnant in the last 3 years after our miscarriage. The thing that bothers me, I guess, about it, I'm actually really excited to hear that, if that makes sense. Just because it kind of gives me hope that, it has been 3 years since we've been pregnant, and it gives me hope. My dog is leaning on me, of course. Sorry, but it does give me hope that we can get pregnant now that there's no blockage. Maybe I have ovulated down that tube quite a few times, or if not every time, and that is the reason that we have not been able to get pregnant again since the miscarriage. So I'm really hoping that brings us some luck. Yeah, but they were able to clear out everything. My mom actually even stated that my doctor seemed a little too proud of himself, which I find funny, because he's like that. He takes pride in everything and that he says and does. And I've only met him a few times now, because he's my new OB, but I definitely knew that about him the minute I seen him. So I've never liked a doctor or anything. I've never been happy to see a doctor, but this guy I definitely am happy with, and I can't even tell you how relieved I am to even be able to say that, because I can't stand doctors, unfortunately. They scare the crap out of me, just from past experience with them. So, yeah, so everything went really, really good. They were able to clean it out. He said he was absolutely happy with their job as far as cleaning it out. Nice squeaky new clean uterus, and hopefully it is the environment that I need to have my baby snuggle up in. So Now, next Friday, I get to talk with the doctor. I get to see pictures and everything. My husband actually said that the polyps looked like jellyfish. So that'll be interesting to see. He said it was really gross looking, so I'm interested in seeing what they actually looked like. But, yeah, I go Friday at 11 o'clock, and then we also get to talk about the game plan, which is Clomid. We are going to try Clomid again, only because that is the medication that I got pregnant on. Not that Femara wouldn't work, because maybe it was the fallopian tube issue, but I don't know. I just feel like Clomid is what got me pregnant the first time, and we should try that again. So hopefully we'll start right on 100, because I didn't ovulate at all on 50. So hopefully we'll start on 100 and see what happens from there. But I guess that's about it. I will probably check back with you guys after I speak with him and let you know of any updates from there and exactly what we're going to do. You know, it sounds like a silly question, but with having PCOS, it's hard to really know your body. And, you know, I'm 32 years old and I'm still learning about my body. So I know this might be a silly question, and I know there's no silly questions, but I was supposed to have my period next week, and now that I've been cleaned out, that would mean my endometrium lining, everything was cleaned out. I'm not expecting a period, and I don't think I should be. So if anybody has comments about that, or can tell me, or I guess reassure me that I probably won't have a period, just let me know below what you think. I would think that I'm not going to have a cycle. I would think that it's basically like a fresh new day. So maybe the DNC would be considered day one. So let me know. Should I consider the DNC day one? I did have bleeding. It was nothing severe. It's really, like, today it's pretty much spotting. No red blood or anything. Yesterday I had a little bit of red blood, but nothing today. So it's just strange, but I don't know what to do. Do I count it as day one or what? So let me know. Everybody else, I hope everybody else is doing great, and all you new mommies out there, I'm so excited for you and cannot wait to see these pregnancy vlogs. Everybody else, I hope you have a great weekend, and I will talk to you later. Take care.